We continue our coverage on safety in gyms in the age of COVID. This week, the Centers for Disease Control and Prevention released a report that traced COVID outbreaks in indoor gyms. At a gym in Chicago, 55 out of 81 people tested positive for COVID-19 back in August, and at a gym in Hawaii, 21 people contracted the virus in July after attending cycling classes. The common factor in both, the lack of masks. Now, to talk more about COVID safety in gyms, we are now joined by Francesca Schuler, the CEO of In Shape Health Clubs and an advisory board member for California Fitness Alliance. Francesca, thanks for your time today.
Thanks for having me.
What are your thoughts on, the findings in the CDC report?
So I think what's important to note is, as you called out, those were studies from last summer, one in June and one in August, where everyone was still learning about COVID, understanding the right safety protocols and implementing the right safety protocols, both for themselves, meaning do I show up somewhere if I have symptoms, as well as organizations enforcing them. So what we've learned since then, California started way back in June with mandatory masks, mandatory distancing, mandatory testing before showing up for work. So I think we were ahead of the curve. But since then, across the country, everyone tests their employees. Everyone requires masks. We require masks in California. It's critical, and to work out 6 feet apart. So what I appreciated about the article is it just called out how far we've come and what we've learned, and the importance of wearing masks indoors and following safety protocols, which I think in California we've done a great job of enforcing.
So as an advisory board member, I mean, we see gyms that you can look at a regular big box gym like 24-Hour Fitness, Equinox, where they have machines set up at a certain distance, and someone could be completely far away in the weights area versus someone that's on the treadmills or the stationary bikes. But then you also see boutique studios like like Soul Cycle. I mean, any of these smaller fitness studios. If you've been to a Soul Cycle, you sit in a room with plenty of bicycles. None of them are obviously socially distanced, but at the end of the day, it's still a room where the rooms are closed. The fans may come on every now and then, but it's hot and it's steamy and it's sweaty. Obviously, gyms reopening, for indoor use will be done at least primarily or initially with reduced capacity. But do you think those kind of gyms that do have those smaller rooms that get hot and steamy, are those safe even if we wear masks?
Yeah, so I think every single operator has put in protocols, meaning additional ventilation, capacity constraints. I look at data. We are data driven in the health club business. And unfortunately, California doesn't show contact tracing data. But if you look at Colorado, Illinois, New York, for example, they've been very public about their contact tracing data, and gyms and fitness centers are one of the lowest. New York, for example, it was 0.06 of what cases traced back. So that's recent data up to date through February. And so what that says is that we've all taken the time to implement the right ventilation, the right mask protocol, the right screening before you come in, and the right distancing as well as cleaning protocols in the fitness centers. So, the thing that people forget, I think sometimes, is we're in the health business. We're here to keep your mental health and your physical health. And the last thing we want to do is have anyone get sick in one of our centers. So we've poured hundreds of thousands of dollars to upgrade our facilities, enforce these protocols, and make sure that it's safe, because we want to make sure people can get back to exercise. We're really worried about the mental health crisis in particular that's emerging, and we want to make sure that you can exercise safely indoors. So we feel really good about our safety protocols.
And I think
the data proves it out. The data proves it out. That's what's important.
I think that's something that a lot of people may not necessarily keep in mind. I mean, I know we're also worried about getting the virus, and we try to do everything we can to avoid, coming into contact with the virus. But, things like gyms are designed, a lot of people think of, oh, it's my aesthetic. But no, it's also personal fitness and personal health and as you mentioned, mental health. And to be able to go in and work out safely kind of gets us back on that track of being able to take care of ourselves from not just, a vanity standpoint, but from a a health standpoint. There are a lot of people that have to work out to keep, their heart health, mental health. I know I personally, if I don't, if I'm not active in some way, shape, or form, after a while, I start thinking, I start getting, I don't want to use the word depressed because that's a little extreme for that particular scenario, but I start coming down on myself. So physical fitness is very important for more than just, vanity reasons. You do have to maintain that in order to be healthy in a more broad wellness realm, right?
100% agree. I think, again, back to data and science, all the science points to mental and physical well-being requires you to move and exercise, and completely agree with everything you said. Many of us manage our mental health through exercise because we may not need extreme medications or things like that, but it keeps the endorphins going. I think the second thing that the data really shows is 49 states in the country have opened gyms now by the month of February because they've used the studies and the data and their contact tracing. California is the only state that has not opened gyms yet. And so I think the wealth of data and science that we have amassed during this almost full year of COVID has demonstrated that the safety protocols work in fitness centers, and the public health requires and is essential to have exercise for mental and physical health. And the last point I'll make is I think people have been quite flippant about, oh, just get an at-home solution or an outside solution. But many of the members I serve live in communities where they don't feel safe running outside. They live in multi-generational homes. They can't afford a home gym. And so denying access to exercise is, I think, going to cause a big public health crisis for many years to come. So we feel really good about the safety protocols. As the California Fitness Alliance, we expect our members to follow the safety protocols and adhere to them at all of our alliance members. And we believe that for the greater good of public health, starting to move again and exercising is essential for your physical and mental health.
I will say, living in San Francisco as a female, sometimes you don't feel safe running around with the spike in crime that we're seeing. And in the beginning, when the pandemic first happened, I will say as well, working out at home with videos was kind of nice. But after a while, I just kind of want to get back into the group setting where you have the energy of the other members and the music and all of that. So there is something to be said about that environment as well. And also, these studies, as you mentioned, are from last year when we were in the thick of it. Right now, we are also seeing an increase in vaccinations. More and more people are being vaccinated, and we will reach a point where it's not just the vulnerable people or the frontline workers. It's going to be a large number of just the general public that will be vaccinated. So that'll even decrease, transmission rates even further, almost exponentially at that point.
Correct. That's correct. And I'm excited to see the aggressive rollout of vaccines in California. I just hope that we can get people moving again. We've heard many sad stories about people who've been denied exercise for almost a year now. Monday, it'll be 350 days since gyms have been closed in California, despite some brief reopening. So we are fully confident, as I said, in our safety protocols, and really would encourage everyone to get moving again. And we hope our governor and public health officials follow the lead of 49 other states who have used data and science to realize that public health requires people to exercise. That's part of our holistic health. And I couldn't say it better than you said yourself. You miss being around people, safely distanced, even with a mask. It's still a sense of community. And that, after this long year, will be essential to get California going again. To me, that's critical. And to all of us, that's what we're here. We're in the health business. We want to keep all of us healthy. That's what we do for a living.
Absolutely. So is it safe to say, Francesca, that you don't think that by allowing indoor, fitness classes to resume, that it will not? It's safe to say that you don't think that it will lead to any sort of surge, mini surge, or any surge at all?
No, look, I think that if people follow the rules, if you feel sick, stay home. If you show up, wear a mask, follow the rules. If operators follow the rules, we should be able to operate as safely or more safely than many things that are open, like grocery stores, retailers, because unlike some places, you do wear a mask the whole time you're inside. So I definitely feel confident that we can operate safely in California and get our our communities. We were the healthiest state. I want us to get back there again. That's what we need to. We should have pride in that. And so we're the last one now. We're number 50 out of 50. We got to go back to number 1. So that's the goal. With safety, we are very strict about safety protocols. So our hope is the administration will get us open soon.
I absolutely agree. Well, hopefully things will move in the direction that they have been moving. 2021 has shaped up to be a better year than 2020. That was obviously not a very difficult thing to do, but hopefully we'll continue moving in the direction that we're moving, so at least we can slowly but surely approach a sense of normalcy. Well, Francesca Schuler, we really appreciate your time, and we look forward to seeing everything kind of opening back up in a safe way and everyone staying healthy. Thanks for so much for joining us.
Agree. Looking forward to working out together one of these days. Thanks for having me.
Absolutely. Thank you.